Hey, Danny. Danny, is it 11 o'clock? Are you still letting in?
Last one's joining now. I've just hit record, so when you're ready.
Okay, you started record, have you? Well, let's make a start and be prompt because I know how busy you all are at the moment. So Happy New Year, everybody. My name is Simon Kidwell. I'm the head teacher of Hertford Manor Primary School and Nursery in Cheshire. I'm also the branch secretary of Cheshire NAHT. And for some people, this might be your first Coronacast. So a Coronacast is a meeting that has evolved from the first lockdown, actually. And it evolved because we were getting so many questions when we had lockdown 1 back in March. I remember the first meeting was quite a ropey affair, and my friend Vinny was on there. He came in, we had a half-hour meeting. He came in at 29 minutes past. So we've got a bit better at Zoom technology now, but hopefully it all goes smoothly. So the Coronacast is it's an area for school leaders to get together to go and find common solutions to the most complex of issues that we're getting. So it's evolved. We now have a weekly one, but we've got a whole lot of questions again now. So it's going to be a really important Coronacast today that we have to do. So I just want to introduce my co-chair, Dan Thomas, who's the CEO of the Learning for Life Partnership.
Morning, everybody. Welcome to our first week back. Just go through the rules for you, everybody. We've got a lot of people online, so please do not unmute your mics unless you are asked to by Simon. If people's mics are open, I will just mute you for you as far as I can. This session is being recorded, so please, if you don't want your faces on this, then please just turn your cameras off. Today, we are really focusing on the medical side of things because obviously the guidance is still coming out. So we are limiting questions really just to medical questions and about the virus itself. We are going to be running another Coronacast this week on Friday, where hopefully guidance will have been clearer. But for NAHT members, there is a meeting tonight this afternoon at 4:30. Please check your NAHT emails just for that link and register on that. But if you have any questions, please do use the chat. We've got Ray, who's going to be curating those questions today, who's just waving at us. So back to you, Simon. Thank you.
Thank you, Dan. We've also got some NEU colleagues joining us as well. So I know Greg's invited NEU colleagues from Northwest. So welcome. You'll find out here that the information we get as head teachers is no better than the information you get as union reps or class teachers. So we are just trying to be fleet-footed and be reactive in terms of our response to this. So I'm absolutely delighted to see everybody. It's lovely to see people. It's been a really tough few days. I think as tough as the first lockdown, if not tougher, in terms of the way we've had this landed on us. But let's not go into that. We're going to do a Coronacast on Friday where we can talk about that a bit more. I'm delighted to welcome Dr. Matt Butler, who's become a good friend to school leaders over the last few months. The first Coronacast, Matt kind of really helped to shine light on the virus because we knew very little about it as school leaders, and he really did equip us with facts. And I think what we found over the last few months, that the more you know about this virus and how it spreads and how it affects people, then the better we can prepare our schools, keep our staff safe, and keep our pupils safe as well. So Matt's he's a geriatrician normally at Adam Brooks Hospital down in Cambridge, but back in March he was redeployed to run the COVID ward, one of the COVID wards, and he was also assigned to source PPE for the whole of the hospital. I know in the summer he went back to doing his normal job as a geriatrician, but he's now opening another COVID ward. He's speaking to us live from the COVID ward in Adam Brooks. I think his office has been commandeered into a changing room. So if you see any doctors getting changed behind him, please don't do a screenshot. So welcome, Matt. It's really great to see you. And I've got to say, Matt's got some real interest as well because he's got 2 children, a boy and a girl at Ray's school, and he's got a brother who's a teacher as well. So Matt does do this for nothing and out of the goodness of his own heart, but he does have a vested interest to make sure that we're as safe as possible in schools. Welcome, Matt, and it's good to see you. And this Coronacast, we're planning, Matt, for an hour, usually 40 minutes, but you're okay to join us with an hour, but we know how busy you are, and yeah, we will draw it to an end at 12 o'clock, Ray, if that's okay.
Yeah, so hello everyone. Did you want me just to start and give you an overview and an update as to where we are?
Yeah, we usually start actually. This is, I think, the 6th time we've been joined by Matt, and actually we've not seen him since November. And what we normally start with is what's changed since November. Is that okay, Matt, to start with that?
Yeah, perfect.
Format?
So hello everyone. So as Simon said, I'm Matt Butler. The ward that I'm currently on opened over the weekend when I was working, and is now full, having been empty on Friday. Had 3, then 7, then 17, and now a 35 ward bedded ward is now full, and we've opened up a second one since then. So in total we have 5 wards in the hospital that are opening. We're predicting potentially a tripling of that number, and we're already above the number in the first peak. So just to put it into context, we are much worse now than we were even at the height of the first peak. So looking at why that is, because obviously we've had various degrees of lockdowns. We've been through the tiering system, and as you're well aware, we've entered a new national lockdown. That national lockdown does differ quite significantly from March, if you remember back to March, in that a lot of non-essential shops although they were open, people were avoiding them much more than they are now. If you look at sort of the news items, you still see more people on the streets now than we did back in March, where it was pretty much ghost town territory. Now, the context of what I want to tell you about is back in March, we managed to get the R number down to 0.6. So with everything, if you imagine what we were doing back in March with complete school closures, except for key worker kids, but I think you'll recognise actually your provision now seems to be, from what I've heard, more than key worker provision back in March. Or more people taking work, because I think there was a big fear factor there the first time around. And we got the R number down to 0.6. Now, this variant of the virus, the new variant, is felt to increase R by around about 0.5. There's a range in that, so it could be as low as 0.3. It could be as high as 0.7. And bearing in mind that this is only UK data, it would be really helpful if, now that it is effectively global, if we get confirmation of this increase in transmissibility outside of the UK, because you need to know whether something that's happening in your setting is reproducible, because if it isn't reproducible in other countries and it's not as transmissible there, then we have to ask ourselves, then therefore it's not the virus that's more transmissible, it must be behavior, and it must be adherence to rules and things. But putting it into context, so we went back in March, 0.6 our number, when everyone was doing absolutely everything and really adhering to the stay-at-home guidance. If it does increase R by 0.5, then if we did absolutely everything back in March, we would still have a growing epidemic, which is why Professor Whitty, when he was talking yesterday on the press briefing, is really, I mean, I think you could get the sense from the Chief Medical Officer for England how grave a situation we are in at the moment. So I think when you take that into consideration, what we are basically doing with schools is to try and get control of the epidemic. And we really do need to get control of the epidemic, because if we continue to have escalating numbers, we are going to get overwhelmed. I mean, I'm pretty sure my hospital's going to be overwhelmed, because the tripling of the inpatients that we're seeing is going to exceed every single medical bed that we have. So to put that into context, every single other medical person that would have been in the hospital back in the hospital normally will have to then be looked after in surgical beds, and we'll have to cancel. We've already cancelled surgery that can wait more than 24 hours. So we're only doing emergency operations now. Obviously, if you've got cancer and you're coming in for an operation, then that's devastating because you've had it cancelled. So that is the context that we are in. Looking at school closures, I was asked a lot about this on sort of social media pre sort of closure, and I was very clear that school closures are only to be done from an epidemic perspective. And I was asked lots of direct messaging about this. Why did I think that possibly schools should close? And it's purely from an epidemic perspective, because we still know with this new variant that kids are probably as affected as before, though potentially they're a little bit more likely to be infected than before. We don't know exactly to what extent yet, but I think we have to be cautious and say that children are likely to be a bit more transmissible with this new variant. But also what we know about schools and the environment is that it doesn't look to be any more severe in its disease progression to adults. So when you're looking at teachers, if you get this virus, the new variant, you're not any more likely to progress to severe disease than if you got the older variant that's been circulating up until September. So I was very clear, and I was asked for quite a few comments from NEU colleagues of yours that that schools closure is purely to be sort of mandated from a pandemic epidemic sort of measure, because we've always known that schools, because they introduce mixing for staff between sort of staff, obviously you're bringing in dinner ladies, you've got groundskeepers, you've got parents congregating at entrances, and then the children mixing. They will increase the R number nationally, but what we found actually over the autumn term was that actually we could keep R below 1, but have schools open by doing a series of other measures, namely the tiering system. However, with the new variant, obviously that's no longer possible, because if you've already got all the lockdown plus the variant is adding on to R by about 0.5, then you're going to take it above 1, and that's without schools open. So if you open schools, you would increase it. I think that the estimate is still that schools are between about 0.3 and 0.5. So that's a bit about the new variant and why schools have closed. I think I'd be reassured from what I've seen in patients that clinically the disease is exactly the same. We're still getting exactly the same number of the proportion of patients that sort of we treat and get better. And this, remember, is with dexamethasone now. So we have a treatment that we can give to effectively reduce the proportion that progress to severe disease and ultimately die by about a third. So our experience with dexamethasone has not changed with this new variant, in that we're still seeing the same proportion, but it is no better. So obviously, if you've got a more transmissible variant, the fact that you are infecting more people, and then therefore the pandemic is growing, you're exposing more people to the same risk. And actually, bizarrely, you're much better off having a virus that's twice as deadly, or 50% more deadly, than 50% more transmissible. You'll have many more deaths in a 50% more transmissible virus than you will do in a 50% more deadly virus, just by the nature of many more people will become infected. And current estimates, if you looked at the 29th of December, so that was starting to build in the Christmas day, we had around about 80,000 cases a day. And the current ONS data suggests 1 in 50. So I don't know how many people are on this Coronacast, but if there's 200, you'd expect 4 of you to have coronavirus. Now that's on, you probably, obviously, if you're on a Coronacast and without symptoms, you're one of the 1 in 3 that are asymptomatic. But that just puts it into context as to how many people have it. So I think, is that the first, is that good enough for where we are?
Really helpful. And I mean, what I'd like to do, Matt, get this QA'd and onto YouTube as soon as you can do it, because I think parents need to hear that message that you gave initially, especially those schools which have been inundated with parents that don't seem to be understanding that how challenging this is. Matt, in terms of the new variant and spread from pupil to teacher, I know we've been told consistently that teaching as a workplace is no more dangerous than other workplaces, but that data seems quite old now. They've been quoting that figure since the start of November. Is there any data around transmission from pupil to teacher?
Yeah, so not direct transmission. That if you remember when this variant sort of first peaked, and the Neil Ferguson paper from Imperial came out that I I know a
Yeah.
couple of you have had a read of, that did show increased transmission to children. But then we went into the Christmas holidays. It then went into every other age group, and every other age group caught up with children effectively. Alistair Munro is very hot on this, and he thinks they were around about a quarter likely to get it. Obviously they were in schools and mixing more, so the attack rates may be the same. They had more opportunity to get it than adults, but the fact that they were getting it probably around the same proportion as adults meant that they were less likely to be infected per dose, if you like, of infection. Because the way I would read the new variant is that we are no longer confident that that is the case, then I think you have to infer that children are probably sort of as, maybe not as likely, because obviously there are other factors at play that we've talked about previously to children, mainly going back to the very first Coronacast, that you're still more likely to get infection from people within your peer group. So the people you congregate with more, and in the household, obviously, so transmission within the household. But certainly we don't have any new evidence like the Australian study or the PHE study. Because if you remember when the PHE study came out, that came out in the summer holiday and was reflecting sort of 2 months previously. They will be looking at, obviously, now that we have more surveillance and more testing available, a sample of children that swab positive and a sample of sort of teachers locally that swab positive will be likely to be investigated using something called whole genome sequencing to see whether the virus is so similar that you can infer that they got it fairly soon after another one was infected. And that will be all coming out in the wash, but those things are probably not going to report till, say, the early spring. It takes a long time to do these sort of quite in-depth studies, but nothing that I've seen.
Two things, Matt. It was reported in the Times Edge yesterday that there's been a freedom of information request, and the rate amongst teachers is a lot higher in Birmingham and Leeds, and also that the secondary age pupils are the highest in terms of infection in the whole country. I took that, Matt, to read that actually the country, we're in lockdown in November, and we weren't in schools. So I wasn't reading that to say, oh, it must have been school spread. It could have been, but it was the fact that we had more opportunity in those groups to get spread when this new variant was emerging. Is that the correct reading of it?
It is the correct reading. So schools are a mirror to what is happening in your locality. So you are many more times likely to get infected at home than you are, the hierarchy goes home, workplace, and then social settings, of which I tend to put in schools in that, because when they do the hierarchy. So whether or not, I mean, you could argue it could be work, but I think certainly with the first variant, I put it more as a likelihood of social settings. Maybe actually as a cautious approach, you want to maybe assume you are more like, well, particularly because we can't go to social settings actually, so it's just home and work now for you guys, but you're still more likely to be infected by your children, or you're more likely to give infection to your children than you are picking up at school. But yeah, I think doing so, I think I wouldn't worry necessarily if they can't give you the data, like the freedom of information requests. You can't commission data you can't commission a novel piece of work. You can only commission it if it's routinely collected. But they with the PHE's involvement, they will want to know whether the new variant is transmitting more in schools. So I wouldn't worry if you don't get an answer from your freedom of information requests. It will just take time. And I think the PHE, sort of the fact that it took a couple of months just to read into, if you think back to sort of the spring summer term, it took a couple of months to come out with actually the really robust data that showed back then with the old variant that there was only a very few number of cases then, but obviously it will take the same amount of time for the new variant.
And Matt, in my school, it's certainly it's been the adults as well, but not my school because we've had no staff-to-staff spread. But in Cheshire West, where my school is located, staff-to-staff spread has been pretty common actually, considering children in a far greater ratio. and that, so I've really kind of drilled, in terms of making sure that staff to staff contact is absolutely minimal. I had a conversation with NEU yesterday because some head teachers are asking all their staff to be in, and my view as a head teacher is that we should be saying, if you want to work from home, you can. Now, some people, if they're doing remote learning, they can't actually, they haven't got an office, or they've got, 20 people on Wi-Fi like Dan has in Family Von Trapp. But, what's your view on that over
So definitely.
Staff to staff?
So absolutely. And it will be a struggle. So if it's hard to do it from home, but it's doable, you do it from home. If you have to absolutely for technology reasons come into work, then do not then use that as an opportunity to catch up. You must treat it as if you are at home and you are not mixing with other people. Reducing contacts is number one in this. Reducing social contacts, reducing work contacts is absolutely number one. So when I'm off on I was actually meant to be on an admin week this week, but when I'm normally on a admin week, I do not go into work. I'm on call, so I have to see patients on the ward, but I live 15 minutes away. So what I then do is I go directly to the ward, I see the patient, and then I come back and I minimize my time that I'm in hospital, and I do all my documentation at home. So if I'm doing that and I'm seeing patients, I have to physically be in the hospital. The reason I do that is because there are places that I have to get to my office, for example, that mean it's impossible for me to not bump into people. And the people I might bump into might be immunosuppressed patients. But certainly, if you can work from home, you must work from home. The stay-at-home guidance is only going to work, the lockdown is only going to work if as many people as possible stay at home. And I think that then spreads to sort of what children you then accept into schools. Obviously, the guidance is very clear as to who is counted as critical workers, and I don't see any wiggle room in that. If there was a doubt, I would err on the side of caution and restrict numbers coming in, and then take it up maybe with the local authority if there's a debate about what someone's occupation counts as. But certainly the messaging should be, even if you are a key worker, if you can work from home, please do. And I think that needs to be stressed. And you as head teachers are instrumental in trying to sort of play school's part in restricting the spread of this virus.
Now, some schools, I heard from a CEO colleague yesterday that they've got 70% requests in. I've heard of special schools with north of 70%. And we know that our nurseries have not been told to close for our youngest pupils. What are your thoughts on that, Matt?
So nurseries in particular, I think they're, even with the transmission that we know from PHE, because bubbles are very small within nurseries, and I think the way they've managed it, or should be managing it, is because there's a sort of teacher to pupil or child ratio is a lot lower than say in schools, and that were you to get an infection, it's much easier to sort of close it down. But they should certainly be having very, very small bubbles and not moving staff between bubbles. So they should do absolutely everything they can to maintain the integrity of what should be a very small bubble, and therefore the risk to nurseries should be very, very low.
Okay. Might ask Ruth to come in at the end with a question, but
yeah,
not
I saw
now,
there
Ruth.
was
Not now, Ruth. Okay, so but in terms of schools getting north of 70% of their pupil population in,
that's worrying. That would not work.
Yeah, I mean, last time we kind of worked on an interesting figure last time when we locked down, and we were locked down hard last time. We locked down nationally, and there was only about 3% of children coming in, so it was very, very low. But we worked on a figure because Gavin Williamson said in Parliament they expected 10% of the school population to be in. And I'm assuming he got that figure from the medical people, and he just pluck it out of the air. So that's why we went for a very hard be at home if you can with the parents last time. So we could really do with some guidance, not from you because you're not there, but we're calling for as a union some better guidance around that, because when you've got schools with north of 70% in, like Matt said, it just ain't going to work. We might as well be fully open.
And your argument is with 10% of pupils in, we got the R down to 0.6. If the virus raises it by 0.5 anyway, even if you got it, so let's say optimistically it's 0.4. the raise to the R with the new variant. If you then did exactly what you did back in March, you've got an R of 1. And that means that we're going to get admissions into hospital that are going to remain constant. We're not going to have a decreasing epidemic. So that is the argument with this new virus. And remember that the lockdown outside of schools is also less strict. So there are relaxations on exercise. There are relaxations around, I think, well, I don't know, I haven't looked at sort of necessarily what the meeting arrangements are, but say I don't think we had so many in the way of support bubbles back at the very beginning. So they're already sort of breaking integrity of bubbles.
And we just had better societal attitude. I mean, the amount of traffic on the road is a good indicator, isn't it?
Yeah.
And
yeah.
It was like a ghost town. But please don't go back to your LAs or your CEOs and say Simon Kidwell said 10%. I'm just talking about how we kind of talked around that figure during lockdown 1. But there's going to be a real tension there, because the key worker list, you could have 70 to 80% of your population. And some, especially if you at a school next to a hospital, for example, it's a very, very broad list. So,
and I think the other argument, Simon, is that what you want to do, everything that we've learned about this virus, with sort of minimizing class sizes, testing, all of that, distancing, all of those measures are made much easier if you have fewer numbers in the class. So you're going to be able to better sort of contain it and mitigate against it if you can get down to lower numbers.
Yeah, and we might be able to go over 10%. I mean, I've got more than 10% in our school currently, because we are better at managing it and keeping children safe. And we've had many schools that have had 0 infections. Many schools actually. So I think we hear about the real horror stories. We've only had one school completely shut down, one primary school completely shut down out of 130 in Cheshire West. So yeah, we've got good. So I'm not saying the 10% is the figure we have to do, but I'm just saying how we established that last time. But we need some clear guidance, because clearly 70, 80% just is not going to work as well. So we'll wait and hopefully get some guidance to DFE on that, guidance from the NHT to support. Matt, next thing, in terms of mitigations, you spoke a lot at the initial Coronacast about the things we could do around mitigations. When I spoke to you in November, we talked about aerosol spread, and that was kind of just emerging, the knowledge about aerosol spread. Any updates on that?
Yeah, so there have been some updates with regards to national bodies recognising that aerosol and airborne spread is a main route. So not the main route, but it is one of the main routes. So the CDC in America classify airborne and aerosol spread as a main route, and they put it on a par with droplet and surface spread. The difference that makes to what you do, I've always been a big proponent to optimizing ventilation, optimizing use of external space, use of external space as much as possible in between, so using it as a buffer so that you don't have children in the same space for a protracted period, and effectively talking about changing the air within a classroom fairly regularly. I think I gave, I haven't looked back at my previous one, but I've completely moved to being more of a proponent of that than if you remember back in the first Coronacast. And I think at one point I said it may be responsible for 10%. Now that is the current Public Health England sort of feeling, that it isn't a common route of spread. It is a route of spread, particularly in closed environments with poor ventilation with lots of people. But that's why I've always said that classes could be that, because you've got more pupils, you might not have up-to-date ventilation systems, and you potentially are in there for a long time. But also, when you're looking at mitigation, you have to look at the harms. And I don't see, apart from thermal comfort, I don't see any harm. And I've asked this from sort of expert infection control people. Is there any harm ever to opening a window, apart from making you feel a bit cold? And there aren't. So you're never going to increase the chance that you get a virus. The thing that you need to watch out for is that the flow of the air is out outwards. So obviously you'll get a little bit of a draft in, but it's much better to open the window top and bottom, because the external air, if you've got top and bottom windows, because the external hot air, the internal hot air will go out the top, and then it will draw clean air in through the bottom. So you won't then get sort of, if you just opened it at the bottom, you need to make sure that if you are in if you can feel that the warm air is leaving past you, that you need to make sure that you're not downwind of someone effectively. So you
Matt,
want
what
to
about external doors, but going into internal spaces? Are they helpful to have?
there's certain any opening,
Yeah.
opening, and two ports of entry is better than one.
Mm.
You clear
Yeah.
with the flow, you clear it much better.
Yeah, I mean, one of the issues we do have, though, is around temperature. I worked in the school, at my previous headship had boiler problems, and we tried staying open in the winter when the boilers are open, and there is a temperature where children get very, very cold working in the classroom. So I do think, we need
so you
to be
don't need to do it.
that.
Yeah, you don't need to do it permanently. So what we're sort of advocating for is maybe 15 minutes every couple of hours, or leaving it open a little bit more continuously.
And the Germans use that concept. They call it impact ventilation, don't they? Or Stoßlüften. And I think if you've ever taught a Smiley Year 6 class, you've probably been doing it quite a lot in your career. So just think about, you can sometimes do the sniff test, can't you, as a teacher? So
if it smells stale, then it's likely to have
because I know our NEU rep was getting some complaints from members yesterday saying they were freezing cold.
So that's not, so you can't have it where it's not comfortable to teach in, but that's probably going overly cautious.
I mean, health and safety, it is no recommended temperature, but health and safety say minimum 16 degrees in a classroom, but people can't walk out if it's below. But just be sensible, because I know from experience of trying to keep children in during a boiler breakdown, it is impossible at this time of year. Matt, anything around, I mean, face coverings, we could talk about that for hours, couldn't we? So I'm not sure I want to go into face coverings today, but just a quick one. If, face coverings for children and for adults, but if they're to wear a face covering, they've still got to have the really good hand hygiene when putting them and taking them off. So if you haven't got that good hand hygiene and you're just taking them on and off constantly, is there any point in having one on?
I think so. From what we've now learnt about surface spread, I would more to having a mask on all the time but touching it more than not having a mask on at all. I think masking in schools is a potential really easy thing easy thing to do to mitigate spread. Now that's my personal view. I think that's been my view for some time, even going back to, I think it was May or the one before that I actually felt masking, because it actually engenders part of the social contract as well, that you are telling pupils that you're not actually protecting yourself, you're protecting others. That's quite a good thing to be teaching. What I would say about that is, if you have someone that wants to wear it, if say your teachers want to wear them, I would encourage it. If they want to wear a visor with a mask, let them. That it shouldn't be stopped, because it's only going to be positive, unless you're getting communication difficulties. But if children want to wear it, then maybe, because that obviously carries the stigma, if there's one child, maybe then involve all the parents of that bubble and say, there's a child that really wants to wear a mask. We would encourage you, if you want to, just to be sort of show solidarity with them, because it's much worse to be in a position where you want to wear something but you feel like you're putting yourself out there, you're going to be bullied if you do, rather than actually, let's say, no, it's really good that he wants to do that. He wants to do it for us, not for himself or herself, and encourage it that way. It will help. If say this new variant is more transmissible, which I'm not saying, but if it is, you have to always weigh the potential cost, but you'll know that better than me.
And as a teacher, I'd always just go, especially with primary school children, the language barrier of wearing a face covering when you're engaging with young children and teaching them.
Caveat that I've never managed to get my daughter or son to wear a mask, but
and I know Steve Alice tried it in his school in September. I think Steve did, so he's not listening, so I'm not going to bring him in. Okay, right. Okay, can we talk about, you said something about fomite spread there, Matt, kind of, because we talked a lot about that and quarantining, reading books, and
so don't do anything differently to what you've been doing. Although we feel it's a little less likely, we do not know whether that's just because everyone is excellent at it now. So do not change what you are doing with regards to quarantining, hand hygiene, and really do emphasize all the things that you've been doing already, because all those things that we were doing were likely to be having some impact on our, although it might be having a little less of an impact, even if we think airborne aerosol spread is a little bit more now, it's still vital that every single measure you can take is done.
Okay, Matt, let's move on to the lateral flow tests. Are they worth doing in schools?
So yes, if they don't alter any of your behavior. So lateral flow tests are good for one reason and one reason only, in that they will tell you if you're positive and you didn't know it. Okay. With regards to telling you whether you're negative, it doesn't tell you whether you're potentially not infectious. So even if you have a negative natural flow test, you need to still behave as if you potentially could be infectious. So what you do not want to have is a situation whereby, say you were doing some mitigation, and then someone said, I've had a negative lateral flow test, therefore we're allowed to mix bubbles. That is not the case. You need to keep absolutely everything the same, but it is very useful, even though it might only identify 50% of those people that are infectious. It's a jolly good job to find those 50%, because actually if you reduce the number of infectious people within an environment, it's less likely that if one person was infected that they would spread, rather than two people infected that it would spread. So it's vitally important to identify those people.
And my understanding, Matt, is that it picks up when you're the most infectious and therefore most likely to infect other people. Is that correct?
So possibly. Infectiousness is very difficult, because we still don't know why some people seem to spread it to many people, and some people don't tend to spread it at all. However, the way that they work, they have to detect actual virus particles. So they have an antibody there that binds to it and then is shown up by reading a double line. And because they're not going through any amplification like we do with PCR, that you have to have a fair amount of infectious particles. And just by nature of the laws of physics, if you've got more infectious particles that then will be read by a test, you're probably more infectious. So it is likely a surrogate marker of infectiousness. But equally, if it's negative, I don't think you can confidently say that someone is not infectious, but it is a jolly good job to pick up the person that has a positive test. So it's very worthwhile doing.
But really important message that even if you've had a negative test, then you behave exactly the same.
You behave exactly the same. If you are a contact and you've been told to isolate for 10 days, having a negative test does not mean that you do not isolate.
But the idea for schools is that the contacts will then come into school every day.
But if they're tested every day.
If they're tested every day. So that's medically sound, is it?
Yes, that's medically sound. Yeah.
Okay, wonderful. Okay, just moving on now to vaccinations. So really great that we've got the vaccinations coming in. And in terms of the priority list, they've been asked by Matt Hancock's been asked a number of times, why aren't teachers on the priority list for phase one? And his answer always is, well, the JVCI hasn't put them there. So it's almost like he's absolving his own political responsibility and blaming them. I mean, I think what I'm concerned about is, I'm not saying we should be tested above shop workers or anything else, but I've got a member on this line who's actually clinically extremely vulnerable, who's going into work, and still quite a few months off being protected. I've got a cleaner in my school who's now got to go and not come in because she's clinically extremely vulnerable. So my view would be, let's do all the teachers. That would be great. However, if we can't do that, I think there's a really strong argument to doing anybody with who's medically vulnerable and any member of staff over 50 that works in a school. That's just my personal view. Is that something which we should campaign for a union?
So the reason for the JVCI, I'm sorry to say, but there just aren't the vaccine stocks in order to roll out phase 2 of the vaccination program. The pure aim of phase 1 is to reduce deaths. Okay, That's why they've gone through the priority groups. And you are in phase 1 if you are clinically extremely vulnerable. And from what they said yesterday, they're hoping by mid-February that they've done a significant proportion of those. I think they said 13 million or something in that group. Now, that is a big undertaking because it means 2 million vaccinations a day, and we're nowhere near that yet. But many people that I know that used to work part-time in healthcare are going to be doing pretty much where we're going to try and get 24/7 vaccination clinics going. And if we get up to 2 million, then it may be that we can get to those sort of clinically extremely vulnerable staff first. I think obviously there's that argument, which is the very rational argument of who is most likely to die, and then therefore we need ultimately to stop people dying. There's obviously the ethical and the political argument when you're then getting into, well, I'm being asked as a teacher to go in and put myself in a situation whereby I'm mixing with lots of people. But what we would need to know is that, and that's what comes back to your freedom of information request, is that actually, is this correlating to an increased risk in the first phase in severe illness in teachers? So I would say that if severe illness is showing to be increasing in teachers, which I haven't seen any evidence that it is, that probably then would be an argument to bump them up the priority list, bearing in mind that everyone that has been infected has already been infected outside of their household, because we're now in lockdown. So those people that are in those JVCI sort of maybe tier 3, tier 4, some of those will be uninfected and completely locked down. So there may be some wiggle room there as to whether teachers sort of are then brought into that lower band in phase 1.
Yeah, I keep telling my mum and dad to stay in for 6 months so I can have their vaccines. That's what
I think that's a very, if everyone took the stay-at-home guidance and we managed to get on top of this and so this is another reason for really seeing schools as a big sort of instigator for a measure of control of the pandemic, is that the quicker we can stop it spreading to the older age groups, the easier it then is to make these difficult sort of ethical arguments about actually you're asking people to go into a situation which they feel uncomfortable. Ethically, there is a responsibility to protect them because they are public servants. But at the moment, not the ethical arguments are drowned out by the sheer numbers of fatalities.
And I think over 50s are right at the bottom of phase 1, aren't they? So if you're over 50, which some of us head teachers are, even though we don't look it, then we're not bad. Matt, are we 2 million tests a day? Is that achievable?
2 million vaccinations a day.
A week. Was it a week?
A week.
Isn't it?
Yeah, 2 million vaccinations a week. It is achievable. We have an amazing National Health Service that delivers millions of flu vaccines, millions of childhood immunization vaccines. The difficulty is we're having to do it over winter when we're traditionally at our busiest. So a lot of people are going to be working extremely hard that traditionally didn't do. I was vaccinated by a clinical psychologist yesterday who hadn't actually vaccinated anyone for about 4 years. And just to emphasize, I'm not clinically extremely vulnerable. Purely the reason that I'm being vaccinated is because I'm seeing people that potentially could die if they get it. So lots of people in hospital have pre-existing infections. I'm very happy that I'm not at increased risk compared to anyone else. I might get a higher dose because I'm obviously exposed to it. But the pure reason that I'm being vaccinated, because there may be teachers on this, head teachers that say, oh, well, I'm his age. But I'm only being vaccinated because the majority of my inpatients only 10 meters down that way are over the age of 70, and they are very likely, obviously I'm looking after COVID patients, but next week I'm not looking after COVID patients. If I were to get asymptomatic infection and unwittingly spread it to them, then that is a risk.
Matt, there are no 24-year-old head teachers on this call, I can guarantee that. So in terms of the vaccinations, just going there, would it help, Matt, is an off-the-wall proposal, if we opened up our school halls to be ready for vaccinations and retrain some of our staff? Would that be something, if we're only getting 10% of the children in, we're going to have a lot of staff capacity. So would that be something?
I would say there are plenty more other communal spaces that we should use, and we shouldn't be bringing more people onto school sites that shouldn't be there. So I would say if you had a setup where you had a gym facility that was out external and you could use a separate entrance and car park, possibly, but I think there's plenty of cafes and large restaurants and things that are shut down now that we could use. So I wouldn't push to get more people on site for schools.
Okay. I think Brewdog have offered their premises.
Brewdog have offered, yeah.
But Dan Thomas does have a massive sports hall, so
Yeah.
I think we need to. Dan needs to go and pilot that with his massive sports hall. Right, that's it for me really in the conversation bit as well. So we've now got 15 minutes, and mindful that Matt's got to go back to work. We've now got 15 minutes, Ray, for the 94 questions.
Yeah. So I tried to consolidate questions into themes, really. So I'm just going to start off with, we have talked about masks, but that has come up as a number of questions or comments. So the idea of teachers wearing masks in communal areas as a suggestion. Other colleagues saying that staff have been wearing masks since about September and it hasn't caused a concern. And so generally conversations about masks. We've got lots of concerns from colleagues, understandably, about nursery. They would really appreciate the data for very young children. People working in nursery have got no PPE. It's impossible to keep the social distance, and they are fully open. So any thoughts or comments, I'm sure, would be welcome on nurseries.
Is that 0 to 3 data available, Matt?
Not that I've seen. I think it's very difficult to get a proper sample from a 3-year-old for obvious reasons, and we still haven't managed to get a reliable saliva test. So I think the data is, from what I've seen, it's always grouped 0 to 10 from the latest sort of batch of modelling data. From what I've seen from external to the UK studies, they are very underrepresented and very unlikely to, if they are swabbed for, because obviously they get a lot of other respiratory viruses around this time anyway, they are less likely to have swab positivity. So that is, if someone has suspected COVID and they swab them, their rates of positivity never match what, say, the older age groups get. I come back to the safety sort of angle. If they obviously, if they want to wear a mask and they're sort of exposed, that's never going to be harmful, unless, I mean, they will pull at it. The kids will, like, you'll have a baby with you and they might pull it off, but then don't panic. It's not, but if you wear a mask, it will be to some degree protective if they were worried. So I wouldn't ever discourage someone if they want to take extra measures. Whether it comes to facilitation, whether you have to then supply them with it, is I don't really know. But I certainly would say do all the other things, mitigations with regards to moving your space, ventilating one room, going into another while it heats up, and then closing the windows in that one, let it heat up, and move around like that. That would be a good thing.
Yeah, I think educationalists thinking of young children of nursery age wearing a face covering would.
Oh no, not the children, not the children. So yeah, not the children, just the adults.
I've got Ruth on as well. Ruth's an advisor for Kent, and she's also a consultant for early years, and very, very well connected. Ruth, I've got a few. I've got a lot of colleagues on. How are the profession feeling at the moment, because they've been told to fully open? And secondly, Ruth, do we have many examples of nurseries having to fully shut down in the autumn? Because I've not spoke to David for a while, who usually gives us that kind of update of how the PVI nurseries are doing. Ruth, would you like to come in and just give us a minute?
Yeah, sure, Simon. I was on a meeting, as you know, last night. I called an emergency meeting with as many people as we could get together across the sector, because there's a lot of confusion. Some local authorities advising maintain nurseries to use their discretion alongside school nurseries, and some are choosing to just have key workers and vulnerable children. Other local authorities telling nurseries that if they don't stay open, they will lose their funding. Some local authorities also saying that the census data, the funding will come from however many children you've got in, regardless of however many you usually have, which is quite a concern. So there's a lot of concern across the sector, a lot of anxiety. We are pulling together a letter at the moment based on what we talked around last night, with some key points that we want to put forward. And once we've got that sort of shaped up, if I share it with colleagues, maybe if I share it with Dan and he can post it out, so colleagues can share, we thought we would send it to local MPs and to, you know, yourselves in the unions to see if we can get some clarity and some support. There's a lot of anxiety.
Yeah, as you know, Ruth, I'm part of the earlier sector council, so we'll certainly be supportive and helping. Just want to bring in Steve Alice here about face coverings, because Steve, you trialled face coverings, didn't you, in the first week back in September? Am I right in that, Steve? For children, is that correct, Steve?
We had a few who came in with them on, and in the end decided, probably alongside Matt's advice, that they just didn't have the discipline to actually wear them. And take them.
So you didn't mandate it, Steve, you just had some coming in. Yeah, you didn't mandate it. Okay, but it'd be interesting to hear, not today, but from any colleagues that have mandated it and it's been successful,
or at least had a pilot or something. If they've just done it as like more of a research almost. Yeah.
Ray, how are we doing?
Yeah, so an area of concern, a broad one, which I think we have been covering, is schools saying that we've got 54% of the school identifying as key workers. Advice, support, guidance about how we can get the numbers down. I think Matt's really giving a really clear message there about schools as instigators of controls. And just the concern over what would be the right number in bubbles. Is it about having 15 in a bubble as we've had before? What about mixing year groups, mixing classes? How do we accommodate all of these different children coming in? Do we use the same systems or do we introduce new systems?
Yeah, I don't want Matt to answer that really, because I think it's up to the government to give us guidance on that. I mean, last time when we did the hard lockdown last time, we went and had those hard conversations with parents. It was absolutely, do you need this childcare? Do you need it? And it wasn't about, are you a key worker or not, like Matt said, because that's quite clear on the list. But is this an absolute last resort bit of childcare for you?
The local authority.
We're not having those conversations now, Ray, because
I think it is going to vary by local authority, because somebody on the call here has said that they've not had the support from their local authority, but Cambridgeshire Local Authority have been very good and very clear with us about communicating with parents that schools are genuinely a last resort. So last night when I sent out the letter, I emphasised in bold, as many colleagues did across Cambridge, that they shouldn't just assume that we want as many children in as possible. So I've been really very pleasantly surprised with the lower numbers that we've had, but that's been as a result of a good steer from the local authority.
Yeah, and I'm hoping we'll get a good steer very, very soon. But the problem is, Ray, of course, last time we had about 4 days to establish and have these conversations with parents. This time we're told 8 o'clock at night, and then we had to open the next day.
Yeah.
So we've been put in an impossible position with our parents. I mean, I had 250 parents on a Zoom call with I think 7 minutes notice, and they were that concerned and that upset. So I was able to give that message, but that's only because my community are well versed in Zoom. But it's just, they put us in a dreadful position. And I think some schools may have to review, especially if they're 80%. If that's sustainable, and have those hard conversations we've got back to. But we can't decide that now. Matt can't decide it. I can't decide it. We need guidance from the DFE. And if the DFE aren't giving us guidance, we need our unions to really, and I've got NEU colleagues on the thing, and they've just put in a lot of section 44 because they don't feel safe. And what we're hearing from Matt today, I think if we don't get numbers down, we're going to get a whole lot of our, anybody can put in a section 44. It doesn't have to be NEU. So anybody can put that in, but if I would imagine we'll get a whole raft of them if we're running as high as 80% in some schools. So,
but I also think just to absolutely counter that point, because I could put in a section 44.
We all could.
But here's the reality. I was at the gate this morning, and every gate story is going to be different. But I had a member of my team. One of the parents has been involved in the AstraZeneca Oxford thing. I've got Matt Butler there, who's obviously, you can see the marks on his forehead. I had a firefighter who didn't spend his Christmas with his kids because he's getting families out of cars because they crashed their car on Christmas Day, and I've got another parent who's a nurse and she's working on the COVID ward. So I think, there is this fine balance between
we need to be there for our critical.
We actually need to be there. So somewhere that I fully understand colleagues saying that they are nervous, they are scared, they are anxious, but we do have to. I just firmly believe we have got to play our part. Different question.
Ray, can I just pick that up a second?
No,
And I just
please
want to
do.
make a plea to colleagues, actually, colleagues
Yeah, please
who
do.
are on there and NEU colleagues, you know, and what we want to work together on this.
Yeah.
What we don't want are Facebook groups of staff
Yeah,
collectively deciding that they're all going to down tools.
yeah,
That's really not helpful. We're sympathetic to the people who feel they're not safe, and we
Yeah.
will do everything we can
Yeah.
to go and do that. But we don't want to see this us and them culture, because it's caused
Yeah.
real anxiety this weekend. We are sympathetic to why people don't feel safe, and we're hearing really good medical evidence about safety at the moment. But Ray is dead right. We have a duty, a civic duty, to keep our schools open for key workers who absolutely need us. I've got people working in hospitals. I've got somebody working on the virus who came in yesterday and said, I'm so grateful. So, you know, we cannot shirk away from schools cannot be 100% safe in the circumstances we're in, but we want to put in the mitigations that we can.
But I would clarify safe. So going back to my first point, safety, always clarify that you don't mean safety for staff, because we don't think that staff are more likely to be affected, get severe disease. They might be more likely to get infected. We're all more likely to get infected with the new variant, but that's the case of whatever job you're doing. So the issue with closing schools is purely epidemiological. So if you can get school numbers down to what you had back in March, we would have a significant impact on the pandemic. We'd get virus numbers down, and then we could get out of this quicker. But it's not. I agree with you. It's not an us and them. I mean, I've been going into a work environment where I've been seeing sort of COVID patients, and we've been obviously faced with an actual risk, not a theoretical risk, but an actual risk of getting infection, and yet we're public servants. We go in and we do that, but the message is only those that absolutely have to be have their kids in school, absolutely only those. If it's hard, that is not a reason. If they were managing beforehand, you have to ask the question, well, why were you managing beforehand? And now not. We're going to be much better set up for distance learning than we were then. And I just think that getting the message across, stay at home, and that includes if you can homeschool your children, that is the thing that you should do. It is a moral and a civic duty.
And that includes head teachers making sure their staff have opportunities to work from home. And if you've got vulnerable staff, if we've got low pupil numbers, there's no reason why they can't actually be, in most cases, working from home. So that's the message I'd be giving to the head teacher colleagues.
Simon, and Simon, just to add in something, because colleagues have rightly pointed this out on the chat, is that we are talking about the importance of critical workers, but of course our duty also is around safeguarding, and we categorically know that there are children who really are safest being in school. So I think I am just listening to what other people have corrected me on the chat, which is our broad duty, civic duty around safety, COVID safety and safeguarding. I love what you said there, Matt. You might see some of this coming out in the newsletter. You'll recognize your own words. But, you know, I love this. You know, if it is hard, that is not a reason. You might see those words and say, okay, I said that. I think this is I find this very helpful. Stay at home if you can, if you're able to teach your children at home, even if it is hard, you do this. A question about
Ray, can I just pick up? You know, absolutely. I mean, the vulnerable groups, we must make every endeavour to get them in, because they're the ones that don't come in because the parents are anxious and the parents aren't as informed. So sometimes, and we need to be really making an effort to get those vulnerable children, because they're the ones that we've noticed coming back in September that have really struggled the most. So we do have that duty to our vulnerables and our critical key workers.
A question that
Can this be the last one, Ray?
This is going to be the last one, really. Is about advice over staff saying that they don't want to come in because they have got a critically extremely vulnerable parent or critically extremely vulnerable spouse or child. We were told yesterday from the local authority that that isn't a sufficient reason and that they should still come in, but I don't know if there's guidance that wasn't
sufficient in phase one, and I had a member of staff who felt like this, but he went and was very fastidious over his routine going back to the home. He'd change his clothes, put them in the washer, and nothing. He was absolutely fastidious with that, and he's glad he came in, but he really did struggle with that. But he's taken all those absolute measures to keep it as safe as possible. But of course, we can't guarantee safety. The only way we'll guarantee our own personal safety is if we lock ourselves away and do internet shopping.
No one is safe. No one is safe from this virus. We are all safe. We are all as unsafe as everyone else in
Matt,
work,
Matt.
Hello?
I think it's Simon's.
Are you there? I think I froze just at the end. I think my broadband is just holding out. Dan, could you summarize for us?
Yes, so nobody is safe from the virus, from this virus, and everybody needs to stay at home as far as they can. I think in terms of clinically extremely vulnerable relatives, family members, people in the home, we've got to just step up how they act in the workplace and the school, and really go on a case by case. I know we've had some where we've offered unpaid leave because of the anxiety and other methods as well. But I'd consult your HR on that one if you're doing that. We have come to 12 o'clock, just past 12 o'clock. So very mindful that we really need to let Matt go and do his incredibly important work. But Matt, you're absolutely brilliant again. There's lots of positives and so much clearer today from listening to you. So from all of us, I think, thank you very much. It's been a great session.
And Matt, could we get it uploaded ASAP, this one? Because we want to get this information out to as broader group as possible. And
just to remind everybody what I said at the beginning, we will be holding another one, Coronacast, on Friday, when hopefully we'll have some better guidance from the DFE and other places at 11 o'clock. After this meeting, I will send out a link to that. So once again, thanks, Matt. Absolutely fantastic. Thank you to Ray for doing questions. So take care. Stay safe, everybody.
Bye.
See you later. Bye.
Thanks, everyone. Bye.
Thanks. Bye.
Can I just ask how we get onto the link? Because I always get this through a head teacher WhatsApp group.
Yeah, is that Tam?
Yeah.
Hi, Tam. If you just pop your email address into the chat, and I will pick it up and add you onto the link.
Thank you.
Okay. Thanks, Tam. Okay, I've got that. Right, I'm ending the call for everybody. Thank you.